Welcome to the neuromuscular system. We're going to split this particular lecture up across two videos, and the first one we're going to start with is going to be the muscular system. So we want to be able to identify the three types of muscle tissue, identify the characteristics and functions of those muscles, what is the basic structure and function of skeletal muscle, and to also be able to name and locate major superficial and deep skeletal muscles. So let's start with the types of muscle tissue that we have within the body. We have what we call smooth muscle tissue. Smooth muscle tissue makes up the majority of your internal structures, such as your organs, your vessels, such as your arteries, your veins, capillaries. We've then got cardiac muscle tissue. Cardiac muscle tissue specifically just makes up the heart. And then you have your skeletal muscle tissue, which is the muscles that attach to the skeleton. So things like your hamstrings, your quadriceps, triceps, biceps. What we're going to do now, we're going to break these down and go into a little bit more detail on each of these. So let's look at smooth muscle tissue. It's controlled by something called the autonomic nervous system, and we will go over the nervous system in more detail in video 2. But effectively it means the automatic nervous system. It's the part of the nervous system that does things for us that we don't want to have to control. So we don't want to have to be telling our digestive system to digest food. We don't want to have to tell our heart to beat. The autonomic nervous system does that for us. Therefore, it means it's involuntary. It's not under our conscious control. So it's found in structures such as the digestive system, blood vessels, urinary and reproductive systems, and we use it in all processes that maintain the internal body environment. So an example would be the muscles of the digestive system are going to contract to move food through the passageways. Then we've got cardiac muscle tissue. So this is the muscle tissue that is found in the chamber walls of the heart. And we know that the job of the heart is to pump blood around the body and to work continuously. So again, this is going to be part of that autonomic nervous system, which means it's not under our conscious control. And as we learn from the circulatory system, the heart is controlled by that sionatrial node, that little taser or that little pacemaker inside the heart that causes it to contract. Then we have our skeletal muscle now. So skeletal muscle is what we call striated, which means that it is basically striped when you look at it. So if you look at these diagrams here, you'll notice that the muscles have striations. So it's just bundles of fibers all bound together that form a striped kind of pattern running in a particular direction. Muscles are going to attach to the bones across a joint via a tendon, but it's controlled now by what we call the somatic nervous system. So think in terms of semi-automatic. So what we mean by that is it's under our conscious or voluntary control. So to give you an example, we can be walking down the road. You're not necessarily thinking as you're walking down the road, right? Left leg, right leg, right leg, swing left arm, swing right arm. Your body will just kind of do it automatically. However, you have the ability to take control of that. So you can decide, right, I'm going to stop walking or I'm going to stop swinging my arms. I'm now going to go a little bit faster. I'm going to go a little bit slower. So you've got the ability to take control of this system. The way it does that is by contracting a muscle, which is going to pull on a bone that is going to produce that movement for you. And one thing to just bear in mind is the muscles are also working constantly throughout the day to resist the force of gravity to keep your body held upright. What I would like you to do now is pause this video and I want you to just kind of study some of the names of the muscles, because it's going to be important throughout the course that you know the Latin names for important muscles within the body. It could potentially also be worth maybe just drawing the outline of a human body, practice labeling it yourself as well. So take a moment to either pause this or to take a screenshot and focus on memorizing those major muscles. The one thing I will note is the two names at the top. We've got anterior muscles and posterior. In anatomical terms, anterior means anything at the front, posterior means anything at the back. So, looking at the basic structure of a skeletal muscle, what I want to first explain is your muscles don't actually pull apart and get smaller like this. All we've done is pulled those layers out to give you a better image. So first thing we need to note is you can see that this muscle is held onto the bone via a tendon, and it has a fascia around it. So the job of a fascia is to bind something together. If you then look at the muscle belly, that just refers to the bulk of the muscle. So it doesn't matter whether this is a bicep, a tricep, a quad, a hamstring, whatever it might be that you're looking at, whatever muscle we're referring to, the main bulk of that will just be called the muscle belly. And then you've got this epimysium. So there's a few things here that end with ium. You've got the epimysium, the perimysium, and the endomysium. In order to get these in the right order, think if you use an EpiPen, you're puncturing the surface of the muscle. So the epi is always going to be the surface layer. Endo is the deepest layer. And just think that it's at the end. Therefore, the perimysium will fall in between. But one thing to note about the epimysium is it's almost like if you think of a sausage, the meat is compressed within a sausage skin, and the skin is what holds it all in place. This is exactly what the epimysium does, is it holds all of those fibers in place to effectively stop the muscle over time from falling apart. The perimysium are those whitish kind of lines that separate those groups of bundled fibers. So they just act as like a separator to stop everything clashing too much internally. But each of those sections is what we call a fasciculi. So you can see we've kind of grabbed one and pulled it out there to give you more detail. A fasciculi is a group of muscle fibers. And you can see those muscle fibers being pulled out again into what we call a myofibril. And the important thing to really kind of take from this image is that myofibril, because the myofibril is where muscle contraction is going to take place. And what we're going to try and explain over the next few slides is how a muscle actually contracts, how it lengthens, how it shortens during a movement. Because if you think of a basic exercise like a bicep curl, as you're curling the weight up towards the shoulder, the muscle is contracting but it's shortening. As we lower it back down, the muscle is still contracting but it's now lengthening. And what we're going to try and explain is how does a muscle shorten and lengthen? And it's all to do with these myofibrils. So if we look at a myofibril here, this is what we call the sarcomere. And inside that sarcomere, we have two types of filaments. And this is really important to make note of because you're likely going to get quizzed on a question about this in your theory exam as to which is the thin filament, which is the thick. So what we need to know is that the thin filament is called an actin. The thick filament looks like those little kind of tentacles, those little hooks. They're called myosin. And what we're going to try and show you in these next few slides is what actually happens. So I want you to imagine like the muscle is made up of layers. As a muscle shortens, those layers go in opposite directions to each other. So if we look at this here, so we know these little red hooks are the myosin. The surface layer there is the actin. So what actually happens now, when we go to shorten a muscle, this myosin pops up, it grabs hold of that layer above and it pulls it in close. When we go to relax, those layers will come down and it allows it to lengthen back out. Same process happens again if we go to do another curl of that kind of bicep curl. These will all pop up slowly, hook onto that layer, and they pull it in. But one thing that I want to note, and we're just going to go back a few slides here, is this sarcomere here. It has internally what they call calcium pumps. And the reason this is important to know is because calcium is key to muscle contraction. We're kind of taught from a young age you need calcium for like strong teeth, strong bones. But actually you need calcium for muscle contractions as well. So as these myosin hooks come up, calcium acts almost like a glue or a binding agent, which allows those myosin hooks to hook onto the actin. Once it's ready to release, the calcium disperses, the hooks can now release off of it. So that is what we call the sliding filament theory. Now the next thing I want to talk to you about is different types of muscle fibers, because we have something called a fast twitch and something called a slow twitch muscle fiber. So again, I would say quickly grab a screen grab of this because it would be important to know the difference. So your type 1 fibers are what we refer to as slow. Your type 2A are intermediate and your type 2B are fast. So to basically sum that up, think of it in terms of fatiguing or tiring out. So your type 1 are slow to fatigue and tire out, which means they're very good for endurance-based events. Type 2B tire out fast. So they're very good for producing a lot of power very quickly, but you can't maintain that level of intensity. So the odds are most people will be better at utilizing one over another. So if you are more of an endurance athlete, you is better at cross country, you're better at running marathons than you are, say, sprinting, you will be better at using type 1 slow fibers. If you're more of a power lifter or a sprinter, as an example, you are better at utilizing your type 2B fibers. However, you can fall in the middle and be what we call a type 2A, which is where you have the ability to be as good at one than you are the other. So you could go and run a marathon, but you could also do 100-meter sprinting and be just as good as say somebody else who can only use one. Okay, what is the Valsalva effect? So the Valsalva effect, as it states there at the bottom, the Valsalva effect results in decreased return of blood to the heart, reduced cardiac output, and abdominal elevation of blood pressure and heart rate. So what we're referring to here is your breathing technique during an exercise and what that does to the body. So what we want to try and do, and what we need to encourage our clients to do, is we need to focus on exhaling, so breathing out during the lifting phase of an exercise. So it's normally what the hardest part of an exercise is. We need to focus on breathing in during the lowering phase or the easier part of that exercise. So to give you a kind of visual example, think of a squat. As you lower yourself down into the squat, that's normally the easy part because gravity will help you drop down. So you want to be taking a deep breath in at this point. As you go to push back up, you're now fighting gravity, you've got the weight on your back as well. That's when you need to be slowly releasing that air and breathing out. If you don't do that and you hold your breath, that's where this bottom section is going to come in and everything's going to increase, your blood pressure will increase, and it can cause you to pass out or faint. So we need to encourage our clients to breathe out during the hardest part of an exercise, and we just refer to that process as the Valsalva effect. So, pelvic muscles. Looking at the pelvic floor, it's effectively the muscles that make up the inside of the pelvis, and there's a couple of functions that these have. First two is to provide support for any pelvic organs and to also prevent stress incontinence. And stress incontinence just refers to wetting yourself. So the more you can kind of train these muscles, the less likely you are when you kind of get into, say, like your older years, the less chances there are going to be of you wetting yourself. But this also comes for anybody who's, say, just given birth. You might find that you'll laugh and you wet yourself and things like that if these muscles are weak, and they're naturally going to be weaker after giving birth because the muscles will be stretched out and things like that. So it's important that we focus on training them and strengthening them back up. And one of the ways in which you can do this is, let's say you're going for a wee, try to just stop yourself halfway through for a couple of seconds at a time, let go. What this is going to do is cause those muscles to basically contract, and it's like you've just done a rep. So it's important that we do focus on training these. Having strong muscles in this region is going to facilitate birth by resisting the descent of the presenting baby. But it also forms what we call part of the inner unit, which we'll cover a little bit later on in more detail when we talk about the core on another day. But effectively, the inner unit is the bottom section of your core muscles. So what I want to go over now is a couple of, I suppose, things we refer to, words we use when we're talking about muscles. So we have things like origins and insertions. We then got different words that we use to talk about different phases of contraction. So we're just going to go through a lot of these terms now. So the origin of a muscle, if you think of somebody's origin story, it's the start point of a muscle. The insertion is the end of a muscle. So how do we know which is the start and which is the end? In the majority of circumstances, the origin is the end of the muscle that doesn't move and stays pretty much stationary when that particular muscle is contracted. So I'm going to use the example of a bicep curl again. So if you're doing a bicep curl, the top portion of that bicep around by the shoulder doesn't actually move. So that would be the origin. The part that is moving is close to the elbow because that's where the movement's going to occur. So that is going to be the insertion end of the bicep. So the origin is the point that pretty much stays stationary. The insertion is the end that moves. Then we've got muscle contractions. We have what we call a concentric, an eccentric, and an isometric contraction that can occur. So concentric refers to the muscle shortening under tension. So again, we use the example of a bicep curl here. It's that lifting phase. Eccentric refers to the muscle lengthening under tension, which is why it's so important that when we've got our clients with us and we're training them, we focus on slowly lowering the weight back down with whatever exercise you're doing. If you just kind of let it drop, you're getting no work through that eccentric phase. And the eccentric is where the majority of the strength comes from. So if you're lowering that under control, you're going to be focusing on strengthening the muscle. So we don't want to miss out on that by just letting gravity drop the weight down and only focusing on that lift. Then you've got isometric, which is static. So this is when a muscle contracts, but no movement is actually occurring. So it's not lengthening, it's not shortening. Example of this would be a plank. You're holding a stationary position, yet your abs are working to keep you upright, but you're not lengthening them and you're not shortening them. Then we've got the roles of the muscles now. So one thing to note is this refers to both, and in your exams sometimes they'll refer to it as a prime mover, sometimes they'll use the word agonist. You just need to know they're exactly the same thing. So the agonist is the main muscle working in that exercise. So in a tricep extension, the agonist is going to be the tricep, which means because that muscle's contracting, the opposite muscle to that has to relax, which is the bicep. So the bicep is what we call an antagonist. It's the muscle relaxing because the bicep can't contract at the same time as the tricep because both want to pull the arm in different directions. Contracting the tricep wants the arm to straighten out and extend. Contracting the bicep wants to curl the arm up. Both can't do that or you're just stuck in a stationary position. So when training an agonist like the tricep, the bicep is the antagonist because it automatically relaxes. We then have something called a synergist. A synergist now is the muscle that helps support the movement but isn't the main muscle working. So in this particular example here, it's the posterior deltoid. That is helping to support the movement. So it's what we call a secondary muscle. It's there, it's doing a bit of work, but it's not the main muscle we're intending to work. It's there helping out a little bit. And then finally, we have a fixator. So a fixator is the muscle that anchors you into that position. It's what holds everything in place and stabilizes the movement. So again, in this particular example, it's going to be the traps, particularly the upper traps now. Then we have joint actions. So this is something that you're going to really need to focus on studying because you will get questioned about this in your exam. So as an example, they may say, what joint action is occurring during the upward phase of a bicep curl? You would need to know, that's flexion of the elbow. So I'm going to briefly cover some of these, but they can apply to multiple areas. So flexion is when the angle of a joint decreases. So if you think of a bicep curl, the upward phase, the angle in the elbow is decreasing. So that is flexion of the elbow. You can also get flexion of the knee, which would be a hamstring curl when you're pulling that heel towards your bum. So you're decreasing the angle of the knee. Extension now is the opposite. So lowering a bicep curl would be extension of the elbow. Lowering on a hamstring curl would be extension of the knee. You've then got internal and external rotation, which is when the joint moves on an axis. So internal would be you pulling your arms in, so you're kind of working these rotator cuff muscles. External rotation is rotating that shoulder joint out. Then you'll notice at the bottom here we have adduction and abduction. Let's focus on abduction first. If you are being abducted, you are being taken away. So abduction is when you move a body part away from the midline of the body. So as you'll notice there, the gentleman there is doing a lateral raise, sorry. So he's bringing that arm up, but it's going away from the body. Adduction now starts with the word add. So you're adding that body part back towards the midline of the body. And then the bottom two on the right here is you've got horizontal extension, horizontal flexion. So both of these movements would occur if you were doing something like cable flyers. So let's start with the second one, horizontal flexion. Horizontal flexion is when you bring the arm across the body now. So that joint is still decreasing, so it's flexion, but you're going horizontally instead now. And then horizontal extension would be you're starting in the middle, but you're bringing it out away. Another two examples of flexion and extension here is of the spine. So flexing the spine would be bringing it closer to the hips if you're leaning forward. Extension of the spine is when you're standing upright. So an example here would be during a deadlift. On the way down would be flexion, on the way up would be extension. Then we have lateral flexion, which is just a sideways flexing of that area. So you can see here, example of this would be you're working the obliques if you're holding a dumbbell and you're lowering it down towards the knee, bringing it back up. Rotation often gets confused with another one we'll talk about later on. But what you need to know is that rotation is when a joint or muscle as such rotates on an axis. So turning yourself round, but staying upright. The one it often gets confused with is if you was to draw circles with your arm. People often think, oh, well, you're rotating, but it's not. That would be called circumduction, which we'll talk about in a bit. So rotation is just when you rotate on an axis. The same as if you were standing upright and you just look left, look right. That would be rotation of the cervical spine. Onto the bottom row here now, we've got elevation and depression. So think if we're using American terms here, an elevator goes up. So raising your shoulders up would be elevation of the shoulder girdle. And think now depression. If you're depressed, you feel down. So what we're doing now is pulling something down. So lowering the shoulders back down. And then staying on the theme of the shoulder girdle here, we have protraction and retraction. If you was to retract a statement, you're taking it back. So retraction is, as an example they're given here, pulling your shoulders back. Therefore, protraction is you're pushing your shoulders forward. Again, examples we've already given there of flexion and extension for the bicep curl. Then you've got pronation and supination. So this refers to your wrist position. So when you're performing an exercise, you're either going to take a pronated grip, which is an overhand, or a supinated grip, which is an underhand. Easiest way to work this out, think supinated. If you're holding a bowl of soup, that is the position your hands are going to be in. And then again, we've got a couple more examples of extension, flexion, abduction, and adduction for you there at the bottom. And then your last ones now is we have two more examples of internal and external rotation, but this time for the lower body. So rotating that kind of ankle in and out. And then I mentioned circumduction. So if you're drawing a circle, that's circumduction. It's not rotation. So don't get confused between the two there. And again, some more examples of flexion extension for different areas. But the last ones now, we're going to look at the ankles. We have what we call eversion and inversion. So this just refers to the position that the ankle is in. And then if we look at the bottom two on the right now, we have dorsiflexion and plantar flexion. So plantar flexion is when you point your toes down. Dorsiflexion now is raising the ankle, raising it up so the toes are starting to point up. And that is this particular section covered. And if you want to take a break now, what we're going to do is we're going to move on to the next video.